these are nice low back exercises. I call them lumbar facet exercises, but they're really good exercises in general for low back mobility and very good for spinal stenosis as well. And what you do is you lie on your back, and by placing a sofa pillow under your pelvis, it takes the movement out of the pelvis and lets you do a better job of isolating the lumbar spine. Okay? And for me, I'm bigger than you, and I fold that pillow in half and put it under my pelvis, but you're of small stature, and so I think the pillow is just fine. Yeah, okay. Yeah. So you could experiment with it, fold it in half, and see if you like that better or not.
Okay.
All right? Mm-hmm. All right. So your hips and knees are bent at 90 degrees. Your feet are on the sofa.
This way?
That's fine. Okay. That's okay. But yeah, right there's 90. Yeah. Good. All right. Okay. So what you're going to do is you're going to roll your pelvis up and down, not towards the ceiling, but you're going to roll it like a ball, bringing your belly button towards your nose. Good. So it's just rolling forward and backward. Yeah, that's called a pelvic tilt. So you should feel your low back flatten a little bit, and then when you go back the other direction, it arches. And the emphasis is not on the arching. The emphasis is on the flattening.
Oh, okay.
Okay? The name of this is a pelvic tilt.
Okay.
All right? Mm-hmm. 10 of these a day is great. It's what I do before I go to bed at night.
Do I want to go clockwise or do anything of that sort? Like, you know, I can rotate.
You can. Side to side. Yeah, you can do that as well. You're doing a clockwise rotation.
Yeah.
And then you're doing a counterclockwise, and that's a good one too.
Okay.
Okay? Mm-hmm. Again, 10 reps is great. 30 is fabulous. All right?
Okay.
So yeah, so you can rotate the pelvis clockwise and counterclockwise.
Okay.
And then a challenging one, but very helpful, is to glide your pelvis sideways. Purely sideways. And yeah, I can see that you're doing it correct. I don't know if the video camera picks up that movement or not, but it's a pure left and right side glide of the pelvis.
I'm more stuck this way.
Okay.
Yeah.
All right. Well, by repeating it, you know, 10 to 30 times, maybe that will soften up.
Yeah.
And if it's limited in one direction, sometimes going the opposite direction opens up that movement.
Okay.
Okay? Especially if it's uncomfortable going to the left, then I would emphasize the stretches to the right, do 10 of those, and then see if you can then increase motion to the left.
It hurts more going to the right, actually.
Okay.
Yeah, it's just, yeah.
Okay, so I would emphasize the other way.
Yeah, okay.
Okay? Mm-hmm. Good. And then you bring your knees together and your feet together, all right? And now you're going to very gently rotate them left and right, a very small range, okay? I don't want you to stretch it. No, 90 degrees at the hips. I don't want you to stretch it as far as you can go to either side. You have an annular tear of the disc wall, so I don't want a lot of twisting force acting on that disc. I want very small movement.
Feels good.
Yes.
Feels very good.
Good.
Yeah.
And then when you're done with that, now you just move one leg. You let one knee drop out to the side. Nice. Good. Very good. And then the other one. Excellent. Okay? Mm-hmm. And then you can bring one knee up to your chest. Again, I want the most gentle stretch. Very small, gentle movement. Yeah.
Kind of pulsing?
Yep. Oscillation, yep. Good. And then, of course, you would do the other side.
Okay.
Very small force, very small movement, very gentle. Good. And then you would bring both knees together, hug them both, and just very gentle, small movements. Nice. Good. And now you're going to do a bicycle pump. So you're going to slide the foot up and down on the sofa. You can let it slide on the sofa. Yeah, exactly. Beautiful. Excellent.
Okay.
Very nice. The other thing that's good for your entire spine, all the way up to where your head connects to your neck, is to lie on your back. So what I want you to do is take the pillow out, okay? And lie long ways with your feet down at this end on your back. And you simply, slowly pump your feet up and down. Together. Bring both feet up together.
Oh, like this?
No. Don't bend your knees.
Oh.
Okay, so your knees are straight. Yes, you're simply pumping the foot up and down. Okay? And it might take a while for this movement to translate through your whole spine.
Wow.
Okay? It takes me about 10, and then I feel my head bobbing up and down.
Okay.
Okay? So on this one, 30 is a very good number.
Okay.
You can certainly do more than that.
Okay.
Okay?
Yes.
And so this summarizes, I'll do one more stretch I'll show you.
Okay.
And I live it. I do these every night. Go back the other position and put the pillow under your pelvis. Now, bring both legs straight up. Good. I hope we have enough light. There's a dark piece of furniture behind your leg. But let me turn on one of those lights. So that's a way that I stretch my hamstrings. Is I bring both legs up. Yep, knees are straight. Okay. And I pull my toes down. Okay. Pull the toes down towards your stomach.
I can't do it anymore.
Good. Do you feel a nice hamstring stretch?
Oh, yeah.
Good. Excellent. I do that for up to 5 minutes.
Can you do it against the wall?
You can do it against a wall.
Yeah.
Yeah?
Just to start out with?
Sure.
Okay.
Sure, that'd be fine.
You do it for 5 minutes.
Yeah.
Okay.
Okay?
Yeah.
And then I thought of one more.
Yeah.
Okay?
Oh, bring it on.
Now,
I'm good.
bring your knees outside your shoulders.
This way?
Yeah, good.
This
So
way?
grab both knees. Yep.
Okay.
And they're pointing just outside your shoulders. And you maintain that gentle stretch for at least 2 minutes.
Okay.
Okay?
Yeah.
It's a very different stretch than when you bring them towards your chest.
Yeah.
This rotates the pelvis backwards more so than the lumbar facet joints.
Oh my God, that feels so good.
Nice.
Do I do it on the pillow?
Yeah.
Okay.
Yeah, pillow under the pelvis.
Okay.
Okay?
Thank you.
So I'll stop filming and I'll post it on YouTube and I'll put it on your flash drive.